and thank you for joining us. With us is Courtney McGovern, a nurse practitioner specializing in infectious disease and travel health. Courtney, good to see you. Thank you for joining us.
Yes, thank you for having me.
Well, let's learn about infectious disease and travel health, and we'll start with the infectious disease part because people are somewhat familiar with that. Let's talk a little bit about that.
So as far as infectious disease goes, we see patients both in hospital, in wound clinic, and also in an outpatient clinic. And so we see a wide variety of things. In the hospital, if there's an infection that is persistent or something complicated, we get consulted on those cases. And we do typically follow those patients up after hospital discharge as well. If they follow up in the wound clinic, we will see them there, or sometimes the wound clinic will call us with an infection in a wound, and we go up to see the patient in the wound clinic to save them an extra trip. And then we can coordinate care with the provider who's caring for them there. In our outpatient clinic, we do also take outpatient referrals. So any specialist or primary care provider can refer to us if a patient has any sort of infection. They send over the records, we review them, and then we get the patient scheduled for a visit and go from there with treatment.
It seems like an awful lot of work goes into making sure that doesn't happen to a patient, but things do happen.
They do, yes.
So maybe, and again, staying with infectious disease, and you kind of highlighted some of those things, but kind of walk us through again the various things that may occur with a patient that, again, you guys would be stepping in and looking at.
Right, so of course there's a lot of different types of infections. We see bloodstream infections, bone infections, wound infections. We also see different types of pneumonia, abdominal infections, infections from where a patient has hardware such as a knee replacement that they've had in the past, maybe now that's infected. So there's a pretty wide range of things. Sometimes we're consulted if they don't know where the infection is coming from. So we know a patient has an infection, but we don't know where it is. So they'll bring us on board to help investigate that further. Sometimes we'll also be consulted for just a urinary tract infection or something that sounds simple, but it's built up resistance to most of our common antibiotics. So they'll bring us on board for help with that as well. So lots of different types of infections. There are viral infections as well that sometimes we've been brought on board for just to help with supportive care and make sure nothing else is going on.
So that has to be fascinating for you because I'm sure time isn't on your side necessarily, but there's that aspect of troubleshooting and problem solving.
Correct.
And you may have a patient that may have an infection but might not realize how serious of an infection it is.
Right.
So, or I feel something here, but maybe it's caused by something somewhere else in the body. So there's that
right.
Your job of going in and trying to track all that down and figuring all that out.
Yeah, it's very interesting work, and you definitely see a lot of different things and have to kind of keep your eyes open and look for the zebra, so to say, where sometimes we don't know where these infections are coming from, or we don't know where the symptoms are coming from. So we have to do some pretty deep digging. Sometimes you ask questions and the patients are like, why are you asking me that? But it pertains to looking for this infection source in a lot of them.
How much work goes into having those conversations with the, and not all the time is that a possibility, right?
Right.
But you're getting as much information as possible and then going back and trying to research, just again, get all the information that you can. Are you talking with your coworkers? Kind of talk about how everything comes together to help diagnose somebody.
Right, so I work alongside a physician, Dr. Rosero, so we discuss patients, and then we also discuss with the team who's taking care of the patients, so whether they be in the ICU or on a general medical floor, as far as in the hospital goes, or if any other specialists are involved with their care, we'll discuss with them. Outpatients, we'll discuss with whoever has referred to us. If they've seen other specialists that might be addressing some of the symptoms, we'll talk with them. And in the wound clinic, there are physicians there each day, so if we get called up there for a patient, we'll discuss the patient's history with them, their ongoing plan of care. So a lot of collaboration goes into coming up with a plan for treatment for people.
And I'm sure even the littlest conversation could play a big role in
Absolutely.
Okay, trying to figure everything out.
Right,
Like,
right.
Why didn't you tell me that?
Right. Well, and sometimes we have to bring family members in. One, if the patient can't speak for themselves, but also even some of these patients who are able to talk to us, they're sick, so they aren't giving a good history. So with their permission, if we're able to talk to their family members, we will do that sometimes as well.
And I'm sure there's been conversations of, have you noticed this? Or, you're trying to obviously narrow things down.
Absolutely.
So now we're going to talk about travel health.
Okay.
And this is interesting. Maybe somebody's heard of travel health, maybe they haven't, but kind of give us what it is, because some people think all sorts of things about travel health when they hear that.
So what we do for travel health is if we have somebody who is traveling out of the country, different vaccinations are recommended. Sometimes there are required vaccinations for certain areas, and there are also illnesses that they can contract that we can't vaccinate for. So what we do is we bring them in, we review their history of vaccinations to see if there's anything they've already had, so we don't necessarily have to repeat, and then we recommend all of the recommended vaccines for that area they're going to, as well as any required vaccines for that area that they're going to. So we review all of that. Depending on what vaccines they decide to receive, we'll give those in clinic. And then we also review recommendations for these non-vaccine preventable diseases and things they can do to try and avoid contracting those.
Is this something that tends to get forgotten during your travel plans, or do people think of it at the last moment, think, oh yeah, I should probably get that?
Oftentimes people think of it at the last minute. So we'll see people who are like, I'm leaving next week, or I'm leaving in 2 weeks. We do have a few who will call in advance, which is definitely helpful, so we can make sure we have everything on hand, but we try and keep a pretty good stock of vaccines for those people who do think of it last minute. So that way we can get them what they need before they go on their trip.
And you look at reports, and travel is up this year. People want to get back out. They want to explore. Is it ever too late? Like if somebody comes to you a couple days before leaving, when's the ideal time to look to make sure they're getting vaccinated?
So it's recommended to get their vaccines at least 2 weeks before travel. That way we can give the immune system enough time to actually build immunity to the things we're vaccinating for. And that 2 weeks is if they're up to date on all of their other routine type things, hepatitis B, hepatitis A, things like that, meningitis. So some people are not up to date on their routine vaccines and then also need vaccines for travel. So based on that, we would want them to come in sooner, at least months in advance, to get caught up and get everything that they need for travel. And some people don't know their vaccination history, so sometimes it's kind of just a discussion as to, what vaccines did you get as a kid? Not everybody knows that. So then we have to look at their age and what vaccines were given during that period of childhood, just kind of routinely. And some of them will know, well, I know I got my shots as a kid, I just don't know which ones, so we'll have to just kind of decide based on what was given in that time frame, what years certain things started being given, because now we get a lot more vaccines than they did 30 years ago. So we'll have to look and say, okay, this one was started routinely during this time frame, so you probably didn't have it because you would have been getting your childhood vaccinations before that. We should update you, and things like that. So a lot of factors definitely go into play in deciding what they're going to need to keep them protected when they travel.
Sounds like there's nothing easy in your department. It's like always investigating something.
Yeah,
right?
yeah,
Researching.
definitely.
And is there ever a case where somebody's traveling to a place and you just are like, well, if you want to go, that's fine, but I wouldn't go.
Right, not typically. CDC gives very good updated guidelines, and so we use them to see if there's any travel or health notices in the area that they're traveling to. Sometimes there's an outbreak of something in a certain area, so we can see that very easily by looking at the current CDC travel websites. They also recommend what vaccines are needed for the specific areas and which ones are very high risk for, you could definitely be be in contact or have risk for getting this versus, yeah, this is in the area, but it's low risk, so it's kind of up to you if you want the vaccine or not. So there are guidelines out there that do help quite a bit because they stay very current. It's all very current information that we look at when the patient calls to schedule, but then we look at it again when the patient comes in to make sure there's no new notices or changes in those.
I think, the world's a big place, but I think COVID was sort of an eye-opening experience.
Absolutely.
Realizing how small our planet is and how quickly things can travel.
Right.
How has that just brought awareness to what you do in terms of travel health?
So a lot of people, of course, didn't travel during COVID and want to travel again or want to start traveling now that they're able to. So they very much, some people are very for getting the COVID vaccination, which is recommended as a routine vaccine. If you're traveling, you should be up to date on the COVID and the influenza based on the season. Some people are still hesitant to travel, although we're seeing less and less of that, which is good. Because there are a lot of precautions and guidelines in place now that help keep people safe. And some people, it was just normal for them to be traveling all the time before this, and so they're happy to get back to that reality. We also are seeing a lot of mission trips start back up, which is good. There was a very long pause in that because of COVID, so we're seeing a lot of that starting again. So we get groups of people coming in for vaccinations for trips like that as well.
So the age really is all over the place.
Right. We only are able to see adults at our clinic, but we do have a very wide range of people age-wise who are traveling.
I always envision Dr. House doing the differential diagnosis with the whiteboard.
Right.
Does that happen, or what?
I mean, we don't have a whiteboard, but the
Okay.
discussion is similar sometimes if it's somebody who's a very complicated case. Yes.
Never lupus, though.
I think he always picks sarcoidosis.
Well, there's that too. Yeah, there's a lot. But again, it has to be fascinating where every day is different for you, and whether it's on the infectious disease side, the travel health side. Is that part of the love of what you do?
It is. Yeah, it is. It's definitely, you never know what you're going to walk into each day. Sure, we have someone who I've seen the past couple days, but also we've got new people that we're consulted on most days of the week, and we're getting these new referrals. And oftentimes it's something that you don't see very often, or wow, it's been a while since I've seen something like this, or you get the cases where you're consulted because they don't know what's going on, so you have to do that extra digging and extra research to try and figure out the actual cause of the illness.
What age did you know you wanted to get into healthcare?
I've wanted to since I was a kid. I have a lot of nurses in my family, and so from a very young age, that's something that I wanted to do. Many of my aunts are nurses, and then I pursued nursing straight through out of high school. I went through to get my bachelor's degree in nursing, and I started working there in the hospital for a while, and then I just wanted to do more with it. I enjoyed nursing quite a bit. I loved bedside nursing, but I also saw the provider side of things and that there was more that I could be doing for people. So that's when I went on to get my nurse practitioner.
For somebody who is interested in getting into this field, what advice do you have for them, and what are those positives that can come out of that?
So anybody interested in getting into nursing, I would say, just get as much hands-on experience as you can. When I was in nursing school, I did work as a nurse's aide, so I feel like that provided me a lot of experience before I was even hands-on in school. Once we had our first semester of clinicals, and we could be a nurse's aide at some of the hospitals. And so seeing things in person is much better for learning than just reading it out of a textbook. So you see a lot of things, you get to experience a lot of different cases. And usually when you're working like that, but they know that you're in nursing school, the staff knows, most places are very good about teaching you because they know you're in nursing school. So, early experience, as much hands-on as possible, is definitely a good thing to do if you're wanting to go into the healthcare field, really any of the healthcare fields.
It seems like Meadville Medical Center does a great job welcoming students in at a young
Absolutely.
age, just to get started, just to get some experience.
Yeah, absolutely. We have students here often. There's nursing students on the floors. I know as a nurse practitioner, I've also had nurse practitioner students shadow with me, which is great because they get to see different areas, different things. I've had some in infectious disease that certainly slowed down during COVID, but prior to infectious disease, I worked in an outpatient clinic and I had multiple students come through there as well. And it does seem Meadville Medical Center is always very welcoming to students, and there's a lot of teaching done here, which is great.
Where did you grow up?
Newcastle, down south of Pittsburgh.
Was it important to work in an environment like Meadville Medical Center where you got to know the patients, where you got to be part of the community, make a difference?
Yeah, actually north of Pittsburgh. I'm bad with directions.
That's all right.
So I lived in Newcastle. I grew up there. My parents were still there when I went to college at Edinburgh, so not far from here.
Yeah.
So I did actually work at a hospital closer to Newcastle for a while because I'd go home in summers. So that's where I did. I was a nurse's aide there while I was in nursing school. But it was a small hospital similar to Meadville Medical Center. And so the relationships at a small hospital I see are very close knit. It's more like a family setting. You know most of your coworkers, you know the specialists. It's easy to touch base with somebody or get a hold of somebody if you need input. And I think that's very important with patient care because there has to be good communication so everybody's on the same page and everybody has the same plan going forward for somebody.
Well, if you weren't doing this, was there ever a second option, or was it always this?
I wanted to be a veterinarian. That was my other option. Definitely a big animal lover. So,
do you have a favorite?
Do I have a favorite animal?
Yeah.
I race sled dogs.
Really?
Yeah, so they would be my favorite. We have a small hobby farm, so we have goats and rabbits and chickens and geese and ducks and
so that keeps you pretty
turkeys.
busy.
Yeah, we're very busy. And then we have multiple dogs. I have 3 children and my husband, and we race sled dogs. So that's what we do in our spare time.
Now, 3 children, and are you throwing your husband in as one of the children?
No, he would be the 4th.
Yeah, okay. That's typically how that works. So I was going to ask about hobbies, but it sounds like you're quite busy with family and the farm.
That is our hobby, yeah. So we have a garden and all of our critters that we take care of. The kids are very good. They have the goats are the kids. They belong to the kids, and the rabbits and some of the chickens because they actually show them at the fair. So that's their responsibility. They do 4-H for their rabbits, so a lot of learning going on there, and it's very good for them, I think, to learn those responsibilities at a young age. And then they run the dogs with us too. So they love to hop on the sled, or we have wheeled carts for when there's no snow. And so they love to hop on those and run dogs, and they each have specific dogs that they claim as theirs that they like to run. So yeah, it keeps us busy and it's entertaining as well.
That's fantastic.
Yeah.
That's a great story.
Yeah, it's super fun.
What are you most proud of with what you do professionally?
I actually just joined infectious disease it was when COVID started. So it was a big change for me because I worked in an outpatient family care setting, also through Meadville Medical Center. But when COVID started, the hospital needed more help, infectious disease needed more help, so I kind of transitioned over because I did miss that hospital setting from when I was a bedside nurse, and they needed help, so I thought it would be a great opportunity. I helped out with the hospitalist teams for a while, and then the previous doctor who was here in infectious disease, who has since retired, she was very busy because it was during COVID, and she was kind of running a one-woman show at the time, and needed some help, so I agreed to go with her, and I learned so much. It was an interesting specialty to join at the time that I did because it was during pandemic, and so there was a lot going on, but I really enjoyed, how much I was able to learn, and I continue to learn a lot each day that I'm here because although you can see the same infection in 4 different people, it may present differently in each one, or they may respond to treatment differently. So I really enjoy the investigating process, figuring out what the infection is and how to treat it, but also the continued learning that I get to do each day. And of course, I love providing care to patients, especially in the field that I'm in. oftentimes you can see the results of your treatment because you treat the infection and it's better. That's not always the case, but many of them you can see the progress and see the improvement and see the resolution of the infection. So that's very rewarding as well.
For somebody looking to travel, do they call you directly or do they go to their primary care physician and get referred? How does that
For
work?
travel health, they do not need a referral. They can call our office directly and we will review where they're going with them, talk about the vaccines that they need before they ever come in, and then we get them on the schedule.
And where's the office located?
We're over on Kennedy Street.
Okay. This has been absolutely fascinating, and I've learned a lot. And I was just thinking, I don't know if I've ever thought to call and talk to somebody about making sure I have everything lined up before traveling.
Many people do not, or again, they think about it at the last minute.
Yeah.
So it is, and I don't even know if I would have thought of it before I worked in this field, to be quite honest with you. But now looking at it, it makes sense because United States has different things that circulate than if you're going to go to Africa, which we see, or different places. So it's very important to be up to date on all those things because your immune system isn't prepared for it because we don't have certain things here that they have in other countries.
Whether it's a mission trip or you see those commercials for going with the groups, visiting other countries, it's important to make sure you're vaccinated and ready to travel. Courtney, thank you so much for joining us.
Yeah, thank you for having me.
And we thank you for joining us as well.